Hello, fellow hospitalists, and welcome to Documentation Talks with Dr. Tom. As always, our purpose is to help you get credit for the great work that you are already doing and to help you avoid queries. In other words, we want to help you document like a genius. Today, we are going to revisit a topic that we covered a few months ago, heart failure. As you recall, complete and accurate documentation of heart failure requires only two elements, acuity and etiology. But today's focus will be on helping you capture the severity of illness of your heart failure patients, as well as to help you avoid queries. This is particularly important because, as you probably know, reducing heart failure mortality is the main acute care quality goal for CommonSpirit Health for this fiscal year. By following these tips, hospitalists can help their hospitals achieve this goal. The first tip has to do with staging heart failure. You are probably all familiar with the New York Heart Association staging classification that we've been using for a number of years. The updated heart failure guidelines that the American Heart Association published in 2022 revised the classification system. This is particularly important because capturing the stage in patients who have advanced heart failure help you get credit for how severely ill they are. Particularly important is capturing stage D heart failure or end-stage heart failure. The definition of stage D heart failure is straightforward. It is patients who have severe refractory symptoms in spite of attempts to optimize therapy. Severe symptoms are things such as dyspnea at rest or dyspnea with minimal exertion, such as repositioning in bed or walking just a few steps. It is also important to consider stage D heart failure when your patients are referred for advanced therapeutics, such as an LVAD or a heart transplant. Consider stage D heart failure if your patient's being referred for hospice, or if they're being co-managed by palliative care. Lastly, many of your patients who are frequently readmitted for heart failure may have stage D heart failure. The second tip has to do with capturing comorbidities. Now, we've covered a number of these comorbidities in previous videos, and I encourage you to review these videos. They include malnutrition, kidney disease, encephalopathy, and respiratory failure. Today, we're going to cover a few more important comorbidities. The first is ventricular tachycardia or ventricular fibrillation. The important point here is to explicitly mention these diagnoses, not just refer in the chart to a rhythm strip or an EKG. The second is atrial fibrillation. What is essential here is that you document a type, such as permanent or paroxysmal, and it is also important that you document if your patient has rapid ventricular response. The third is shock. Again, the most important thing on shock is to document an etiology. An example would be cardiogenic shock due to acute on chronic heart failure with a reduced ejection fraction. The last is cardiac arrest. Again, what is most important here is to explicitly state this rather than just state that the patient has received CPR. So in summary, in order to demonstrate how severely ill your patients are who have heart failure, don't forget to stage the patient's heart failure, especially if they have stage D heart failure. And also don't forget to document all those comorbidities. It's that straightforward, hospitalists. Thank you for listening today. Next month, we'll be covering a few important topics that will demonstrate why it is so important and so meaningful for you to document completely and accurately. Thank you.